Hello, my name's Phil. I work at Project 6 in Keighley. I'm Deputy Director of Operations there. Project 6 now has offices in Keighley, Sheffield and Doncaster. Project 6 itself started in Keighley about 30 to 32 years ago. It was started by a group of concerned parents. It's come up from the community. That's where its roots are. One of the ideas of Project 6 when it was over the years has been that if anybody is affected by their own or someone else's substance use, then they should be able to get the help and support they need in the Keighley area. One of the first parts of Project 6 was the needle exchange. We work on a harm reduction model, and we work with people as to where they are. It's not a place where we sort of tell people they've got to stop doing this, that and the other. It's okay, you're doing that. How can we ensure that you're doing it safely? And I think through that work, we get a lot of people then coming to us when they want to make some changes. So as Project 6 grew, there was a recognition that, okay, so the substance use isn't just affecting that individual, it's affecting maybe their parents or their partners or their children. So the project started to grow. It started to grow with working with concerned others. It started to work with the young people of individuals that were using substances. So work has grown in that area as well. Project 6 doesn't sell itself as a prescribing agency. We work on psychosocial interventions. We work with helping people make lifestyle changes so that they can address some of the issues behind their substance use. One of the lecturers at Leeds University when I was there said that you cannot prescribe somebody out of an addiction, which is a really good piece of advice. It's not the medication that you give somebody that helps them to become drink or drug free or in control of their substance use. It's about the work you do around that. It's about the work you do with people to make these lifestyle changes. For example, we will hear from somebody who works on our assist team later on, but I'm just thinking of one of the people that we worked with on assist a while ago. This individual's, he was repeatedly given help for his alcohol issue. However, it wasn't effective. When we started working with him, we looked a bit further into his background. We found out that he was being bullied, and it was his response to this bullying that was causing him to drink heavily and self-harm. So the way that we worked with him was to get him new accommodation away from where he was being bullied, to ensure he was covered by a CCTV camera, and that was it. That was what it needed for this person to make the changes. It wasn't the tablets given by the doctor or the sessions with the psychiatrist. It was making sure he felt safe, then he didn't have to drink, and he didn't self-harm. One of the things that you might not know about voluntary sector organisations like Project 6 is how they're funded. In the past, we had quite a high percentage of our funding came from Public Health England. We could see changes were coming in that funding stream, so our chief exec decided that we should sort of diversify our funding streams. We have money now from the Clinical Commissioning Group. We also have funding from the lottery, and we have offices in Sheffield and Doncaster as well. Some of their funding comes from local sources in that area.